I was dying. I was at death's door. Anytime my heart was going to go. The transplant was an absolute miracle. I could do everything that I could do before. I'm a whole person again. Hershey Medical Center was absolutely, positively amazing. I just can't get over the amount of support that I had. It just feels like a miracle. I had multiple heart attacks before the one that was found. I worked in an operating room, and I was also going to college full time. I was really stressed out, and I needed ankle surgery because my foot was hurting badly. And I went in on a Friday to have my pre-op check done, and I was on my lunch break, and I said, hurry up, I got to get back. I have another case. And they did that 12 lead EKG, and the nurse asked me how I was feeling. And I said, I feel fine. I said, hurry up, though. Come on, I got to go. She walked out of the room, and she came back with doctors. And I was like, what are you doing? And they said, you're having a heart attack, Lois. And I said, I am not. 20 minutes later, I was on the table having a cardiac cath. It was like, bam.
We say about a third of heart attacks occur without the patient knowing. The nerves inside our body are very different than the nerves that go to your fingers and toes and other places in your body. And that was the case with Lois. So when she showed up, she already had a significantly damaged heart and was beginning to struggle with symptoms of heart failure.
Heart failure is a situation where, for a variety of reasons, the heart does not efficiently pump blood to the vital organs, the brain, the kidney, the intestines, et cetera, et cetera.
When they went in and looked here, I had so many heart attacks before that I already had cardiomyopathy. As time went by, I had treatments, I had medications. My heart started to get aggressively more bad. I couldn't walk, I couldn't comb my hair, I couldn't do anything. I was very, 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 very sick.
She had a very serious and indeed life-threatening heart problem, and she took it like a trooper. She would say, all right, what are we going to do next? She and I became a very good team for years in trying to navigate through her cardiomyopathy and congestive heart failure. And she did well for a while, but then she started to kind of decline a little bit. 6 months later, she really declined further. I don't think it took a long time before she was on the list.
When he realized that my cardiomyopathy was so aggressive, he got on the phone right away to Hershey Medical Center, and he got me an appointment the very next day. And thank God for that.
In cases like my friend Lois, we often need help from a university-level hospital. We can do probably 95% of cardiology that needs to be done right here in Berks County, but there often are cases that need a higher level of care, that is to say, a good university hospital, and we're blessed to have Hershey Medical Center, and there is a very good collaboration that we believe benefits the patients of Berks County very well.
When I knew that I was going to need a heart transplant, I did some research to see which hospital I wanted to go to. Hershey Medical Center has a really, really good survival rate. There's no infection rate, and I loved it here. This is where I felt safe.
The long-term survival after heart transplantation at Penn State Health, Hershey Medical Center, is amongst the best in the nation. Almost 600 heart transplants that have been done here. This year is the 40th anniversary, and we have been embracing every new advancement in surgical technique and immunosuppression to continue advancing the field.
I'm sitting here with someone else's heart in my chest, and I wasn't overweight, didn't have high blood pressure, I did not have clogged arteries. The transplant was an absolute miracle. The journey afterwards, that's when they really, really are on it after your transplant.
The immunosuppressant medications have side effects. We have to watch for them, we have to monitor them, and we have to carefully manage that. We have a very sophisticated team and very rigid protocols that we follow in order to safely apply those therapies so patients do well. And in a matter of months, they transform from somebody who's a patient first and dealing with their medical condition as their primary thought to a person who is living life, and being a patient becomes a secondary thought, and that's where Lois is now.
It's almost like a rebirth. you have another chance. I could do everything that I could do before. I'm a whole person again with Hershey Medical Center. You are getting absolutely everything that you need. You don't have to go to a big city. You don't have to go drive all those places. You get everything you need right here.
I think having a strong sense of empathy and being able to put yourself in their shoes and the fear that they're going through, it's a huge, huge driver for us, not just in the clinical realm where we take care of patients, but when we are doing research, when we are looking for the next generation of devices or drugs that prevent rejection. We take huge joy and pride in being able to get people back to their families.
My whole journey, I'm absolute most grateful for it, is probably Dr. Waxler. Dr. Waxler led me on the path to recovery. Every day is such a joy. You wake up and you're like, oh, I woke up.